Welcome back to Morning Break. Even with constant reminders to drink liquids in the summer heat, it is easy to become dehydrated this time of the year. You might not even realize that you are right away. SouthCoast Health primary care physician Dr. Leland Dampier is here with a look at some dangers of dehydration and warning signs to let you know that maybe you might have not been drinking enough. Good morning, how are you?
I'm well, how are you, sir?
I am good. This is a constant conversation at this time of the year. If you are spending any time outside, you have got to stay hydrated.
Absolutely. And I help coach youth football here in Savannah, and one of the big things that we look for is telling parents, have your kid hydrate before practice. If you're going to do an outdoor event, you want to hydrate before practice because that's more important than waiting until after you're dehydrated to catch up. And with the core body temperatures already running 98 degrees and we're out in 107 degree heat index, it's easy to get overheated and dehydrated.
Yeah, when you're preemptive like that, it really can put a lot of issues at bay. Is that important for anybody who's working outside in the heat?
This is important for anyone. Right. Now, ironically, the younger you are, the more tolerance you may have for heat. I tell my older patients, which is the majority of my practice, if you're going to be doing an outdoor activity, you need to hydrate before you go outside because the risk of kidney injuries and the big scary words of heat stroke and heat exhaustion, those things tend to come after you've been involved in it, whereas if you stay ahead of it, you tend to have less of that.
Yeah, we hear dehydration so much that, sometimes we kind of stop paying attention to what are some real dangers to it, but it can be really damaging if you're not careful.
Absolutely. And the big organs that we worry about most, particularly in older people, are kidney damage and potentially brain damage. Thankfully, that's fairly rare. And in the case of sports, the most common sports that you see the most dehydration is football because the kids are wearing pads and at any ages. And thankfully, the Georgia High School Association has temperature rules as to when you can practice. And the NCAA for years used to require athletes to weigh in and out before and after each practice in order to determine basically not just for their weight, but that gave them an idea of their fluid balance.
Yeah, long gone are the days when coaches would put off water breaks as a punishment for players. That's just dangerous to do anything like that, and it's actually illegal now.
Oh yes, in the video, Remember the Titans, you definitely would not practice football in those conditions, or you would have a lot more injuries. Right. The biggest thing is, again, staying hydrated beforehand. Now, if it goes too far and you're unsure or you think you're profoundly dehydrated, that's when you need to seek immediate medical care. You either want to go to, if you feel like you're truly in danger or you have like a body temperature equivalent to a fever greater than 100, then you go to the emergency room, in which case they're going to try to cool you down rapidly, probably give you IV fluids, and in some cases do some blood work and monitor you for a few hours.
Well, let's take a look at some of maybe the hidden dangers because it's more than being thirsty.
Absolutely.
I mean, it can affect even your brain.
Absolutely, and some of the minor things that people don't think about is things as simple as constipation or a sign of dehydration. Right. If your urine is dark in color, as mundane as it sounds, that's an idea that you may be dehydrated as well. The brain and cognitive issues, those typically come when things get more severe, and that is because as you get dehydrated, the blood flow to your brain is decreased. Also, your blood becomes more viscous, which you could think of it as like a thick oil versus something almost becoming grease. Well, that blood, as it becomes dehydrated, it's almost like a sludge. Oh, wow. Okay. So you don't get the perfusion to the brain, and that's where you get into heat stroke and things of that nature, which are much more severe.
Real quickly before we go, let's take a look at some symptoms so people know what to look for. First of all, if you are very thirsty, you are probably dehydrated.
Yes, if you're very thirsty, that is your brain telling you that you need to consume some water, preferably water. And that's, in most cases, you actually sweat out water first, not salt. And if you're in a prolonged period, then you will need some type of sodium-containing fluids. But particularly water is your number one thing. If you want to stay hydrated, water is your best ingredient, for sure.
You mentioned the dark urine, dizzy, lightheadedness, muscle cramps.
Muscle cramps
also. Which our athletes see a lot of.
Absolutely. And that is a result of decreased water intake as well as usually the increased sodium output from the sweat. Okay. So that's why most athletes at the college level in particular will have Gatorade as well as water available to their athletes.
Right. Doctor, thank you so much for being here. Thank you for all this great information, and good luck keeping those kids hydrated on the football field.
We'll do it. Take care.
All right.